you're diving, they will undergo hijama as prophylaxis against disease, many of them. And this is the blood. They think that they already took the bad blood from the person. The other method of treatment was cautery. This is a Qatari man, well known, Salim al-Badid. And these are the tools used in the Gulf. Mainly some nails and metal pieces. However, cautery also is done for a longer time. One of the famous Arab who was putting a big chapter on this was Abu al-Qasim al-Zahrawi, known in the West as Al-Bukakas. And we call him the father of surgery. He was in Andalus, an Arab physician and surgeon. He born was in Zahra, and that's why the name came al-Zahrawi, near Qurtuba. He was expert on the treatment by cauterization. And his great contribution was his book, Kitab al-Tasrif, 30-volume encyclopedia book for that time. He devised tools, unlike the tool that I showed you in the Gulf. He made sophisticated, for each part of the body, a special tool for this. And again in Oman, I took the picture where it showed you how they heated the metal until it became thread, and then apply it on the skin. Of course, it hurt. And now when we see patients in the clinic and a physical examination, we frequently see these scars on their skin left over from the practice. The Arab says cautery is the last treatment, last mode of treatment. However, in the Gulf, it's not the last. Frequently, it's the first. Now, I think we will leap forward and go to our distinguished pioneers in the Gulf, that we will like to honor them. And we took the oldest cardiologists who finished. They are all finished their training and became cardiologists and work in the GCC country before me, 3 cardiologists and 1 surgeon. The first one is Dr. Ali Muhammad Fakhro. He was born in 1932. He is from Bahrain. However, he was born here in Doha. He didn't want to write it in his CV, but I know that for a fact. I don't think the government of Bahrain will mind. He has his bachelor degree from American University in Beirut, and then his medical school there. Then he went to Baylor for internship and residency in Alabama. Fellowship at that time, gastroenterology and cardiology. Dr. Ali, what a strange combination, huh? And that was in Alabama and in Harvard, and he had his American Board of Internal Medicine. He started working as consultant cardiologist in 1966, and then became the head of the department, Minister of Health, Minister of Education, and of all the people I will mention, he's the one I know most, because during the time I was a junior attending the minister's meetings, I always see him, and I admire him, especially his great speeches he was giving us. And after the ministry, he became ambassador in France, Belgium, and Switzerland. I would like to welcome Dr. Ali Fakhro to the podium. نقره زميلا فخريا في الجمعية لكونه من أوائل أطباء القلب الرواد في مجلس التعاون الخليجي. هاي الصيغة موجودة. شكرا جزيلا. ناخذ صورة بعدين جماعية عقب ما تخلص. The second is Dr. Abdul Muhsin Yusuf Al-Abdul Razak. He is a Kuwaiti, born 1934 in Singapore. He trained in Scotland and has his RCP, and also he took his PhD in Charles University in Prague. So he is the only cardiologist between us with a PhD degree also. And he started 1968 in Kuwait as a head of the medical unit. And in 1970 on, head of Department of Cardiology. And he was founding dean of Medical College and rector in Kuwait University. And we like to welcome Dr. Abdul Muhsin Abdul Razak. The third is Dr. Abdullah Muhammad Al-Riyami. He's a Omani, born in Zanzibar. He is a pioneer in Oman medical development. Incidentally, you might ask why in Zanzibar. At that time he was born, Zanzibar was part of the Empire of Oman, who occupied that Zanzibar from 1689 until 1964. He had his primary school in Zanzibar, and then he went in 1959, 1966 to study in Ireland. Maybe if he stayed in Zanzibar, they will not have lost the Zanzibar, but he did. And he had his RCP in UK and returned in Oman 1979, and he started first single room CCU in 1978 and expanded the CCU later. He helped establishing in Oman, pushing for cardiac cath, open heart surgery, and angioplasty. And he was participating in GHA conferences in Oman, and this is his picture during the conferences. Dr. Abdullah Al-Riyami. Now that we've finished with the cardiologist, we turn to the surgeon. Dr. Muhammad Al-Faqih, I think everybody here knows his name very well. He is a pioneer in surgery in Kingdom Saudi Arabia. He was born in 1948. He was born in Iraq. As you see now, all our pioneers born in different place than their country. And maybe if you are born in another country, you will fit to be a pioneer later on. He went to medical school in Iraq and graduated from Baghdad University. His postgraduate training in UK, and he took his FRCS from Glasgow. In 1979, head of Department of Cardiac Surgery in the Prince Sultan Cardiac Center, then chairman of the medical staff and chairman of cardiac department, director of medical administration, and clinical professor in King Saud University, and medical superintendent in Dalla. And he was awarded in Saudi Arabia by the king as a pioneer surgeon also. So it's not only Gulf Heart, but also in the kingdom that he was awarded. Dr. Muhammad Al-Faqih, please come. Thank you. I will stop here, and I will just acknowledge those companies that supported this meeting. And thank you.